All right, it's National Heart Health Month. We've been talking about it throughout the month, and our medical expert, Dr. David Soria from Wellington Regional Medical Center, is joining us this morning to talk about some common misconceptions when it comes to heart health. Nice to have you with us.
Good to
I
see
guess
you
you can't talk about heart health enough. In February, we focused so much on women and heart healthy awareness, but also just overall staying healthy. Earlier this month, John, Holly, and I had an angio screening. It's a unit that goes around, and they did a pretty thorough screening of our heart health. How valuable are those for people?
Well, I think, any time that you can get a screening that's complete, comprehensive, that's easy, that's non-invasive, earlier rather than later, before waiting for symptoms, especially if you have risk factors, it's always a good thing, right? Lowering the threshold and decreasing somebody's resistance to going into a doctor's office or the expense and the inconvenience of going to do that, a lot of times limits us. We're very busy, so we don't do it. If it's easy and they really lower that resistance, they lower the threshold, we get it done, and it can catch some life-threatening diseases. So I think it's a good thing.
Well, I mean, they did examine the carotid artery, the aorta, blood pressure, risk for blood clots in the legs. So it seemed thorough, but I suppose people checking out these mobile companies, and I say mobile, the ones that go from place to place, need to check the reputation and who exactly is doing the testing, correct?
Well, of course, and that's always the case. And I would always recommend that you ask your doctor first, because again, they may say, nope, you need something different, or you know what, the value of that screening is really not that significant. We need to do some other things. So you don't want to rely on that.
Earlier this week, a study came out about, I want to change subjects a little bit, about how some of these over-the-counter drugs for heartburn could promote early onset dementia.
That's right.
What are these over-the-counter drugs, and how concerned are you about this study and the risk?
So like we talked about before, and the class of drugs that are now over-the-counter, but in the past were always prescription, are the proton pump inhibitors. So we have Prilosec, you have Nexium, Prevacid, all of which now are available, or most of which are available over the counter. And in the past, they've always been notoriously safe. You take them once a day, and they're very effective for decreasing the acid in one's stomach, and thus allowing the stomach lining to heal and decrease acid reflux. However, now this study is a little bit concerning. Again, it's not causal, but it's something that we need to look at and certainly ask your doctor about.
Perhaps people taking them can consider changing their diet and maybe get off these over-the-counter meds.
That's right, Rex. That's probably the most important part, and that is, instead of using medicines as a crutch, make sure that you do the necessary lifestyle changes like diet, exercise, things like that, simple things that will decrease your risk and thus heal the process in and of itself without having to rely on medications.
Thank you. We'll wrap it on that. Let's go back to John and Holland.